On this Tuesday night, what soldiers discovered inside 5 Ontario long-term care homes.
I think it's appalling. I think it's disgusting.
Why did it take the military to expose gruesome conditions and shameful neglect?
No matter what it takes, we're going to fix this system.
As Quebec care homes already struggling are now sweltering in a heat wave. Suspended, why Canadian clinical trials of hydroxychloroquine are now on pause. And game on, the NHL's timeline to power forward during the pandemic.
Global National with Dawna Friesen.
Good evening and thanks for joining us. Across this country for weeks now, Canadians have been banned from visiting their loved ones inside long-term care homes, unable to see for themselves what's going on inside. Now the Canadian military has painted a dreadful picture of conditions inside some of them. The premiers of Ontario and Quebec were so desperate last month, they asked soldiers to deploy into homes unable to cope with COVID-19 outbreaks. Now the military has issued a report into 5 homes in Ontario. The 15-page report contains allegations of terrible neglect and lack of hygiene. Here are just some of them. Little or no disinfection. Significant gross fecal contamination was noted in numerous patient rooms. Nurses, PSWs, often observed not changing PPE for several hours while moving between numerous patient rooms. General culture of fear to use supplies because they cost money. Fluid bags, dressings, gowns, gloves. Forceful feeding observed by staff causing audible choking and aspiration. Patients observed crying for help with staff not responding for 30 minutes to over 2 hours.
The reports they provided us were heartbreaking. They were horrific. It's shocking that this can happen here in Canada.
The Ontario government is responsible for inspecting the facilities, so why did it take the military to expose how grim the situation was? Here's how Premier Ford answered that question.
Yes, inspections happen, but it took the military to be there 24/7 every single day. That's when you find out there's cracks in the system, by living the system around the clock every single day.
Ontario's long-term care minister says her government was working on fixing long-standing cracks in the system, and then the pandemic hit, and the situation, she says, became a full-blown crisis.
COVID tipped the homes that were having difficulties with staffing already right over the edge. Canadians cannot tolerate this. We need all levels of government to come together.
Mercedes Stephenson joins me from Ottawa. Mercedes, why did the military write this report and send it up the chain of command?
Dawna, the Department of National Defense says that the troops raised these concerns because they are trained to report anything that potentially jeopardizes their mission or could harm Canadians who they serve. After an initial report was submitted to Ottawa on May 14th, many troops became concerned as days passed on without action. They were concerned that nothing would be done and vulnerable seniors in these homes with no ability to speak out would face the same disturbing conditions troops allege they found them in. One military source described those conditions as, quote, worse than anything I've seen overseas. Here are just some of the conditions that troops allege they found happening in Ontario care homes. Abuse of residents, falsifying of medical documents, COVID-19 patients not being properly isolated, new workers who were not trained, and a blatant disregard or lack of knowledge of how to wear personal protective equipment and how to execute infection control measures. At Hawthorne Place Care Centre, troops reported a cockroach infestation and forceful feeding that caused residents to audibly choke and aspirate. At Eatonville Care Centre, troops reported alleged abusive and inappropriate treatment of residents, including when changing their incontinence products. Troops report that regular staff at the home stopped them from going into patients' rooms to clean or see patients. At Holland Christian Homes, allegations of abuse and neglect. The military described patients dying in what they called unnecessary pain. Troops also said food was left in a resident's mouth while sleeping and that staff did not help residents to eat, instead writing down that they refused food. All of this is raising concerns for families who have seniors in homes and those who will soon enter those homes themselves about how Canada treats our elderly.
Think of the people living in long-term care now who are seeing this on television, who are still in long-term care, who can't talk to their families, don't have outside interaction. This is just going to add to that anxiety and that concern.
Mercedes, this is agonizing for residents and for family members who can't go inside these homes and be advocates for their loved ones. Premier Ford raised the possibility today of criminal charges and promised accountability and justice. Is that just rhetoric?
Dawna, there is a possibility of criminal charges in at least one of the cases, potentially. Of course, these are reports that will have to go to the police who will make those decisions. One example that stood out to us, at Orchard Villa, a patient died, allegedly choking to death after being fed while lying down flat. That's something the troops flagged as being deeply concerning. That incident has now been referred to the coroner's office, and the Premier addressed it today. Others say lack of training is an issue, not just a problem with intentions. And the union tonight pushing back. The union representing workers at two of the care homes that we mentioned say that they welcome the report from the military, but that they have been ringing alarm bells throughout the entire crisis, saying, unfortunately, we've had to fight the provincial government every step of the way to ensure long-term care companies are keeping workers and residents safe.
Mercedes, this report is about 5 homes in Ontario where the military is deployed. They're also in 13 long-term care homes in Quebec, which has had the most deaths from COVID-19. Is there a similar report coming on Quebec?
So I've asked the military, and they haven't said clearly, but I would imagine that there will be a demand to see this, Dawna. People will want to know what's going on there. And keep in mind the larger effect. Right now, there are 39 troops who have been diagnosed with COVID-19, and many more still working in the homes. Dawna?
All right. Mercedes Stephenson in Ottawa, thank you. The first heat wave of the year in Ontario and Quebec is making conditions inside many long-term care homes even more challenging. Temperatures soared to over 30 degrees Celsius today in some places. It's forecast to stay hot for the next few days. Mike Armstrong explains what that means for residents and staff, especially inside older facilities that have no central air conditioning.
When this seniors' residence on Montreal's West Island was built in 1908, air conditioning barely existed. Well, for most of the residents, it still doesn't. Staff tells us it's getting hotter and hotter, and yet the one place to go outside to cool off is off limits.
This is inhumane. I don't know how much I'm going to have to repeat that. It is inhumane, unacceptable.
There are estimates that only 25 to 35% of residents in Quebec long-term care facilities have air conditioning. Newer buildings tend to have central air, but then you also have buildings like this one in Montreal's East End. It's dealt with heat waves, but very rarely in May. This heat wave is hitting very, very early in the season. This building's about 100 years old. It only has a few air conditioners down on this level. When a heat wave normally hits in the summer, there would be dozens of air conditioners sticking out of windows where the residents sleep. That hasn't happened yet. There are dozens and dozens here still in storage. The staff at facilities usually use air-conditioned common areas to cool residents down. That's not always possible right now due to COVID-19 with movement restricted. Even just opening windows and getting air flowing through the building is problematic. They don't want potentially contaminated air passing from one area to another.
It's going to be more complicated this year.
The health minister insists the government has been working on solutions, possibly mobile air conditioners, but says this early heat wave hit before they were ready. Now for staff, a rough situation is getting rougher. They're going through this heat wave in masks, visors, gowns, and gloves.
It's stifling. People under all that protective gear are going to need lots of water and some breaks.
Now this heat wave is also affecting the general public. People without air conditioning are usually told to go to places like malls, those are closed, or community pools. That's not an option right now either. Mike Armstrong, Global News, Montreal.
There's been much debate about the anti-malarial drug hydroxychloroquine. President Trump said he was taking it, but says he's now stopped. He still calls it tremendous. There is evidence, though, it's not. Research published in The Lancet showed an increased risk of death, and the World Health Organization has temporarily halted trials to determine if it's a safe and effective treatment for COVID-19. Canada was taking part in that trial. Heather Yourex-West explains why it's been suspended.
There are concerns that hydroxychloroquine may be doing COVID-19 patients more harm than good.
The executive group has implemented a temporary pause of the hydroxychloroquine arm within the Solidarity trial while the safety data is reviewed.
35 countries, including Canada, had been recruiting patients for the trial at 30 hospitals across the country, although no Canadian trial participants had been given the anti-malaria medication yet.
Mostly it's related to some emerging evidence, not from randomized controlled trials, which are the gold standard, but from observational studies, suggesting that there may be some harm associated with hydroxychloroquine use in hospitalized patients with COVID-19 infection.
That evidence was published last week in The Lancet. It found that after reviewing 96,000 virus patients across 6 continents, there was a higher risk of abnormal heartbeats that could cause heart attacks among those treated with hydroxychloroquine.
The problem with this analysis in the observational study in The Lancet is that without randomizing patients to hydroxychloroquine or no hydroxychloroquine, the assumption is that sicker patients will likely get more medications, and it's impossible to control for that.
A trial safety committee will now review all of the data that has been collected within the randomized control trial so far to determine whether hydroxychloroquine has been causing harm. That review is expected to take 2 weeks.
If there's no harm, then we'll continue, because there still might possibly be benefit associated with its use.
A second Canadian trial out of the University of Calgary has also been suspended, pending further review. Heather Yourex-West, Global News, Calgary.
Tow truck turf war coming up. How Ontario police say they put the brakes on an organized crime ring. Police in Ontario have laid hundreds of charges after an investigation into turf wars between tow truck operators. Investigators believe competition for market control led to property damage and serious violence, even murder. Catherine McDonald is following the story for us. Catherine.
Dawna, York Regional Police north of Toronto have charged 20 people and could be arresting dozens more after allegedly dismantling an organized crime ring involving rival tow truck companies. Over the past 2 years, police across the Greater Toronto Area have responded to dozens of calls for suspicious fires involving tow trucks and many more violent incidents involving tow truck operators. York Regional Police have now arrested 20 people, including the owner of Paramount Towing, also known as Prestige Towing, and employees of other rival towing groups, alleged organized criminals who police say are fighting over turf.
We allege that the competition for control of the towing market has resulted in murders, attempted murders, shootings, assaults, arsons, threats, and property damage.
Apparently motivated by greed, the tow truck drivers arrested allegedly inflated costs and victimized consumers. Police say the accused also deliberately caused collisions with unsuspecting drivers and staged collisions using drivers they'd hired before making fraudulent claims.
Investigators have confirmed the tow companies collaborated with auto repair shops and physiotherapy clinics, as well as car and truck rental companies, to carry out their frauds.
Police say a law firm that was hired by an insurance company to investigate these fraudulent claims was also targeted, starting in January 2019 when someone tried to set the firm on fire. Months later, an employee was threatened at gunpoint, and last September, shots were fired through the front window of the business. Also amongst the charges, 2 counts of first-degree murder for the shooting death of tow truck driver Sohail Rafapur in December 2018. The 3-month joint force investigation with the Toronto Police, the Ontario Provincial Police, and the Canadian Revenue Agency, dubbed Project Platinum, culminated last Wednesday when 21 search warrants were executed, resulting in the seizure of 40 firearms, ammunition, $2 million worth of illicit drugs, and $500,000 in cash.
We are in the process of dismantling 4 distinct criminal organizations through these arrests and those to come.
Police believe there will be less violence here in the Greater Toronto Area as a result of these arrests, and are now calling on the provincial government to regulate the tow truck industry to prevent future violence. Dawna?
Catherine McDonald in Toronto, thanks. Ahead, China's stern warning to Canada as Huawei's CFO braces for a court decision. PPE is at the core of a scandal emerging around digital government minister Joyce Murray. Global News has learned a WeChat social media group run on behalf of the BC Liberal MP was used to crowdsource funding for a lawsuit against a Global News journalist. Last month, our investigation exposed troubling details about China's state-backed effort to stockpile coronavirus safety supplies during the early days of the COVID-19 outbreak. The fundraising appeal led to this exchange in the House of Commons today.
The minister has admitted that her taxpayer-funded political aide is the one who manages her WeChat account and allowed the fundraising campaign to be promoted. Clearly, this is inappropriate. What action has the Prime Minister taken in light of these revelations?
Attacking the integrity of hardworking journalists is absolutely unacceptable. The individual who posted this link on this particular group is no longer a member of this group and is not affiliated with the Electoral District Association in question.
Joyce Murray's communication team says the WeChat post was unacceptable and in no way reflects the minister's views. It says the Vancouver MP uses the platform to engage members of the Chinese-Canadian community. Canada's tense relationship with China could be further tested by a court ruling in Vancouver tomorrow. The BC Supreme Court is set to rule on the extradition case of Huawei executive Meng Wanzhou. She was arrested in Canada in 2018 at the request of the United States, accused of violating sanctions against Iran. China is keeping up the pressure on Canada to release Meng. Abigail Beeman explains what's at stake.
To release the decision on Wednesday.
On the eve of a BC judge's decision that could set Meng Wanzhou free, ruling whether what she's accused of in the United States would be considered a crime in Canada, comes a stern warning from China. Canada should immediately release her, he says, to avoid further damage to China-Canada relations.
One of the good things about having a truly independent justice system is that we don't need to apologize or explain for the decisions taken.
A complicated moment for China-Canada relations, which have already been stretched for some time. Meng, the detainment of Canadians Michael Kovrig and Michael Spavor, widely viewed as retaliation, trade issues, a decision on 5G still pending, and Canada's concern for its citizens in Hong Kong. This weekend, China's embassy in Ottawa condemned Canada's joint statement on proposed national security legislation in Hong Kong, saying we deplore and strongly oppose what it sees as meddling.
We see what the Chinese are referring to as wolf warrior diplomacy, where Chinese representatives abroad and the foreign ministry spokesman, Zhao Lijin, are making statements which are outrageously aggressive and really amounting to a form of disinformation.
Canada has been dealt a very tough hand.
Director of the China Institute, Gordon Holden, points out the Meng case isn't just about tough bilateral relations.
We're caught between Washington and Beijing. That relationship's deteriorating rapidly, especially in an election year in the United States.
If Meng goes free, Holden says, the U.S. won't be pleased. If she doesn't, brace for a long appeals process. The case could drag on for years still, with no betterment of the Canada-China relationship in sight. Abigail Beeman, Global News, Ottawa.
Next, life after COVID-19, what it's like for those who have recovered. The NHL is getting closer to getting back on the ice. It's still not exactly clear when, though. NHL Commissioner Gary Bettman announced today the regular season is over and 24 teams will head straight to the playoffs. They would play in two hub cities, one for the Eastern Conference and one for the West. Those hub cities have yet to be determined, but Edmonton, Toronto, and Vancouver are on the short list. The NHL plan still needs the green light from government and public health officials. A decision will depend on what's happening with the pandemic. Right now, there are some signs of improvement. Canada has had more than 86,000 confirmed cases of COVID-19, and more than half of those people have now recovered. It's possible they could have some immunity to the virus. Jeff Semple explains.
I didn't leave my house for over a month, and I go out, and the world's completely different now.
Kyla Lee is one of the recovered. Global National first spoke with the Vancouver lawyer in early April when she was in self-quarantine with COVID-19.
To be plagued with a fever for 2 weeks, a cough for over 2 weeks.
But today, So how are you feeling now?
Great. Totally back to normal.
Albeit a new normal. Lee stepped outside to find a society gripped with anxiety, while knowing she likely doesn't need to worry.
But I am, I think, probably taking more risks than other people would as far as like when I'm out in public, just because I'm likely immune.
A made-in-Italy blood test, just approved by Health Canada, will be deployed in the coming weeks to help determine whether a patient has been infected and developed antibodies against COVID-19.
Now, so far, we don't think it's possible to get infected again.
And as economies reopen, some businesses are deploying new technology to separate the recovered from the rest. This smartphone software is one of a growing number of so-called immunity passports. The technology, already deployed in some European countries, is used to identify those who've tested positive for antibodies so they can go back to work.
Any and all tools that will help get life back to normal and save lives should be used.
Unsurprisingly, immunity passports are also sparking a slew of scientific and ethical concerns.
You could look at it as being an incentive for workers to deliberately infect themselves in order to get back to work.
And experts aren't sure whether the recovered will remain immune.
So we don't know what the expiry date should be on that passport. So the idea seems useful, it seems attractive, but without an expiry date, we just don't know how long that is a safe assumption.
But there is a growing push to deploy the proof of antibodies technology in certain situations, such as screening incoming international travelers and frontline care workers, where the need is greatest. Jeff Semple, Global News, Toronto.
And that is Global National for this Tuesday. I'm Dawna Friesen. We leave you tonight with this little hoot. Actually, 3 of them, and they're pretty big. The Belgian man in this apartment first thought the noise from his window box was pigeons. Turns out it was Europe's largest owl, the Eurasian eagle owl. And the 3 chicks now have a perfect view of his TV, which they watch together. Take care of yourselves. Bye-bye.